Hello friends, today we are going to discuss about coping with medical malpractice suits, guidelines for doctors. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about medical malpractice suits. What are the impact of this medical malpractice suits on doctor and also on society at large? How do a doctor process this grief? Steps taken by the doctors to deal with this medical malpractice, guidelines will be given in the end of this video. Let's understand, what is this medical malpractice suit? Medical malpractice is defined as an act or a omission by a physician or by any healthcare provider during the treatment of a patient that deviates the accepted norms of practice in the medical community and causes an injury to the patient. Let me put it in a simple word. If a doctor is providing a care to a patient, his care or his services is substandard. That results in the damage of the patient or death of a patient. That death or the injury to the patient should be compensated, either in the form of a civil case or removal of his license to practice, or it may be a criminal case also. Medical malpractice is a specific subset of a tort law that deals with professional negligence. That means a profession or a professional needs to provide a standard care. If the standard care is not met by the profession, then it is called as professional negligence. And in the civil law, it is considered as a tort. What do you mean by tort? Tort is the Norman word for wrong. That means, in simple word, the doctor is wronged. That means he has done something which he is not supposed to do, or his standard of care is below the standard which he is supposed to practice. The tort law is a body of law that creates and provides remedies for civil wrong. Invariably, across the globe, the patient's family member invariably go to the civil court, or it may be to the consumer court, or it may be even to the medical licensing authorities to punish the doctors. What does it mean to a physician? Physician perceives medical malpractice suits in a different way. He feels that he has wronged, or his conduct has fall short of a standard. That means his care has fallen below the standard which he's supposed to keep. That means he's a bad doctor. He's a negligent doctor. And the patient has suffered because of his substandard treatment. Then the medical malpractice suits will win, and the patient or the patient family members will be compensated for the injury. Let's look into the perception of medical malpractice suits by the doctors. Let's understand how the physician looks into this. First and the foremost, majority of the doctors have exaggerated sense of responsibility. That means in medical colleges, the teachers constantly bombard the students by telling that it is the responsibility of the doctor to provide the care to the patient. And if they fail in providing the care or providing the cure, the complete responsibility will be on the doctor, and he has failed, or he is a failed doctor or a wrong doctor. Hence, invariably, the sense of guilt, the sense of not curing the patient, the sense of not providing the care to the patient is constantly in the mind of the doctors. Invariably, most of the doctors are intelligent. They have never failed in the life. Even if they have failed, the harm has not occurred to anybody. But in medical malpractice suit, here the patient and the patient family member will go to the society, or it may be to the court, or maybe to the media, and they say, yes, this doctor's professional care was below standard and there is an injury occurred to me. That means it is a substandard treatment was given or a wrong treatment was given. That induces a huge amount of guilt in the doctor for not providing the care, or he has failed to provide adequate care to the patient. It is a life-changing event for both to the patient party and also to the doctor. Invariably, majority of the doctors are self-critical. Invariably, they do not show. Constantly in their mind, they will have doubt about their ability, feeling of guilt. They ruminate what went wrong, what could I have done to prevent this death or injury. Invariably, this haunts them continuously. This also leads to exaggerated sense of responsibility, which will be shown as a defense or a blame game, or they would like to avoid the patient by not communicating to them whenever there is an injury, because that guilt makes them not to make eye contact with the patient or the patient family members that I have done something wrong. This medical malpractice suits will create a huge havoc in the doctor's life. Let's understand some of the examples. One of the doctors, in his suicide note, he has written like this: dead people cannot be put on trial. So the obvious solution is for me not to be alive. And this doctor killed himself. That is death by suicide. Let's look into the another one. Here, a lady doctor has written in her suicide note, I have done nothing wrong, not killed anyone. Perhaps my death might prove my innocence. And she killed herself. Again, this is the extreme thinking invariably pushing them to commit suicide. Recently in Rajasthan, a lady doctor killed herself. This case I'll be discussing now. This lady doctor did a cesarean. Unfortunately, the pregnant woman died because of the postpartum hemorrhage. The body was taken back to the home. Later, a local politician, relatives of the deceased, and public at large brought the dead body to the hospital. They kept the body in front of the hospital, and a demonstration was staged. The politician, the public at large, demanded the doctor should be arrested and hanged till death. Because of the pressure of the politician, the police booked the doctor for murder, that is, Indian Penal Code, Section 302. The doctor was devastated. She did not know what to do. She wrote a suicidal note. I'll be translating this suicidal note. And she killed herself. In her suicidal note, she had written, I love my husband and children very much. Please do not trouble my husband and children after my death. I did not commit any mistake and did not kill anyone. Postpartum hemorrhage is a severe complication. Stop harassing doctor for this postpartum hemorrhage. My death may prove innocence. Don't harass innocent doctors, please. Please don't let my kids feel the absence of their mother. The lady doctor signed. This was the suicide note recovered after her death. Similarly, one more case which occurred in March 2022, but this occurred in London. This doctor killed himself, and in his suicide note he has written, dead people cannot be put on trial. So the obvious solution is for me not to be alive. Again, this doctor is a celebrity doctor. He was very successful. Unfortunately, a medical malpractice suit was filed against him. Immediately, this doctor committed suicide. Let's move into the understanding of General Medical Council number of cases. As per the UK's report, Over the 3-year period, that is from January 2018 to December 2020, 5 doctors' death by suicide occurred. This is the statistics provided by General Medical Council of UK. Invariably, if you ask a doctor, every time a patient dies, a part of me dies also. Invariably, majority of the doctors, when their family member die, they do not feel the death or a sadness. The main reason being is they have been exposed to death because of the environment they work. And many of the family members feel that this doctor is insensitive. But unfortunately, his emotions already been distributed among his patients and patients' family members. Whenever there is a death of a patient, invariably the violence against healthcare professional is becoming common across the globe. As per the survey conducted by Indian Medical Association, 75% of the doctor has faced violence at workplace. The violence can be verbal abuse, physical abuse, emotional abuse, even destroying the properties of the hospital. And this also adds to the doctor's agony. Invariably, lady doctors are assaulted very badly. And many a time, the local politicians instigate this violence and they take advantage of this situation. Being in the media and bashing the doctors, they feel they will get more votes. Unfortunate, our politicians behave like this. Doctors often commit suicide in a place where they have been emotionally invested and wounded. That means either the doctor kills himself in the hospital or at home whenever they go through this medical malpractice suits or whenever there is a violence against them. Recently, Canadian Medical Association Journal published an article, Physician Suicide. It's an interesting article. I request the viewers to go through this article. If you look at the cognitive process, invariably majority of the doctors are not ready to face these medical malpractice suits. They need to understand it is an occupational hazard. The current society or the contemporary society do not trust anyone. We do not trust the doctors. We do not trust the engineers. Invariably, we do not even trust our neighbors also. In such a scenario, there will be medical malpractice suits against the doctor. Hence, one need to understand it's an occupational hazard. The doctor should prepare himself. Invariably, when you look at the literature, suicide is the only cause of mortality that is higher in physician than in non-physicians. That means the prevalence of suicide in doctors is very high than compared to general population. Whenever there is a death of a patient, it will be a cognitive assault on the physician. He himself feels sad. He himself or herself will feel that he failed. He failed miserably and his skills did not protect a patient. Along with this, if there is a physical assault on the doctor for his failure, will add to the misery. With this, media trial, social media trial, headlines in the newspaper, a failed doctor, a doctor who is a predator, such kind of words will destroy the morale, not only of the doctor, the whole medical profession. A regulatory complaint against the doctor will cause a devastating effect on that person. Majority of the time, whenever there is not even if there is no error by the doctor never forgive themselves for losing a patient. In spite, they know they did their best, but still they feel sorry for themselves and they feel sorry for the patient's party. Many a time, they become highly self-critical and they feel Suicide is the ultimate self punishment that can be given to them. In several cases, the death of a patient seems to be the key factor in pushing the physician to commit suicide. Why do doctors react like this? Why do they think of killing themselves? First and the foremost, patient's death itself is an impact on them. They do not know how to deal this situation. Neither the medical college has taught how to deal the loss of the patient. That means somewhere our medical college failed to prepare our doctors in communicating bad news, dealing with their emotion of loss, dealing with the grief, dealing with the medical malpractice suits have been not taught either in India or across the world. That means our doctors are not prepared for the contemporary world. Along with this, whenever there is a medical malpractice suits, the doctor starts thinking about their standard of care. They feel that they have been accused of substandard care or a bad doctor or a wrong doctor. Invariably, they become highly defensive. Exaggerated sense of responsibility prevents them to say even sorry to the patient. Violence against them, physical violence, verbal violence, emotional violence, makes the doctor becoming more impersonal to the death of the patient. Emotional turmoil takes over. Media trial, social media trial adds burden to the doctor, and invariably they get burnout very easily. Threat of economic loss, loss of livelihood. Imagine the private practice of a doctor revolves around his name. If you are able to tarnish his image or damage his personality in front of the society, he will lose his patients and invariably he becomes jobless. Along with this, threat to the personality causes a severe emotional turmoil to him. Not only this, harassment by colleagues, isolation by his own fellow professionals causes him to go into depression. Police harassment adds to the misery. Feeling of failure in the profession, failure in the society, failed family member. What will my wife think? What will my children think? Augmented with the loss of support from the society by the medical professions triggers emotional turmoil, and death by suicide is the answer. So let's understand the grief. Whenever the patient dies, not only the patient's family goes through the grief, even the doctor also goes through the grief. The grief process was given by Elizabeth Kubler-Ross. Let's understand the stages of grief. Whenever there is a death of a patient, the family and the doctor goes through this shock and denial. How can this happen to me? How can my patient die? There will be a shock. There will be denial. Immediately it will be anger. Anger towards the society, anger towards self, anger towards the patient family members, not bringing them timely. Later bargaining starts, depression, and acceptance. Let's look at this grief process. If you see on the x-axis there is duration, and on the y-axis the emotions. As soon as there is a death, invariably there will be a shock. They will not be able to process what happened immediately. And there will be denial. Denial leads to rise in emotion immediately. There will be anger. Then bargaining starts. Bargaining with anger and depression. And finally, acceptance. And they start practicing again. This grief process invariably takes 2 to 4 weeks. And this grief process is normal. Majority of the time, 95% of the people who go through this grief process will heal by themselves. Only few people require support, and hardly very few require professional help to go through the grief process. Let's see what kind of grief requires professional help. That is complicated grief. This is the normal grief which lasts for 2 to 4 weeks. If there is a exploding grief, as soon as the death occurs, there is a shock and denial leading to exploding grief. The doctor immediately may commit suicide. There may be complete absent grief. That means he does not feel anything to the death of a patient. Or it may be a delayed grief. That means the patient's family members went to the court delayed. Then the grief process may set in. Protracted grief. If the case, medical malpractice suit, lasts for years together, that will result in a protracted grief in the patient, family, and also with the doctor. Further, there will be oscillating grief, which is seen in the physician whenever the case hearing comes. The doctor goes through the grief. Not only the doctor, even the patient's family members also go through this oscillating grief. That means both the parties are in immense pain when the death has occurred. Let's understand the emotions. The emotions are similar both on the patient's family side and also on the physician side. First and the foremost, confusion, disorientation, sadness, feeling of overwhelmed, shock, anger, detached, numbness, irritability, frustration, agitation, fear, and various other combination of these emotions can be seen. During this period, the doctor will not be able to practice. He should take a break from this work. Otherwise, he may harm other patients also. What about his cognition? The doctor thinking process will be denial, that he will feel that he has not done anything wrong. He will be completely denying there is a substandard care. Many a time they feel helpless, they feel hopeless and worthless. Some of the doctors feel exaggerated sense of responsible. They feel, I am useless, I am at fault, I should be punished. There is no future for me in medical practice. Suicidal thoughts, self-harm thoughts. They also feel world is not a good place. They feel paranoia. That means they feel suspicious towards every patient. They feel this patient may give complaint against me. And they start defensive practice. What are the behaviors? Invariably, suicidal thoughts. That leads to death by suicide, suicidal attempt, drug abuse, substance use, alcohol use, aggression towards other patients, fighting attitude, shouting at family, relatives, avoiding operations. They start avoiding taking risk. They start referring most of the patients. They decline patients. They become highly defensive. They do not take any difficult cases. Many of the doctors become withdrawn. They do not meet any colleagues, asocialization, and they start changing the place of practice. Many a time, they decide to stop medical practice. Many a time, they decide changing the profession. They invariably start telling their children not to take medical profession for their career. They discourage them. I have seen a doctor who made his child to quit the medical college because of a medical malpractice suit against him. What is the impact of medical malpractice case? There is an interesting article published by Charles and his colleagues in 1984. The title of the study was Physician's Self-Report of Reaction the malpractice litigation. It's a very interesting article published in American Journal of Psychiatry. They interviewed 154 physicians who had gone through various litigation with regard to medical malpractice. The most commonest emotions can be seen: anger, approximately 87%, changes or mood fluctuation, 77%, inner tension, depressed mood, 70%, frustrated, 70%, irritability, 63%, insomnia, 47%. Invariably, these emotions do not last only for a month. Whenever the case hearing comes, the doctor's emotions starts getting fluctuation. That means there will be oscillating of these emotions. And many doctors decompensate here. They start self-medicating with benzodiazepines, opioids, drugs, alcohol, and they become aggressive with patient and family members. So let's understand the medical malpractice suit and their impact. Let's summarize it. First and the foremost is overwhelming emotions, emotional turmoil. The doctors will have adjustment disorder, depression, complicated grief, insomnia, difficulty in falling asleep, panic attacks, anxiety disorders, drug abuse, substance use, post-traumatic stress disorder. Many a time, the doctor's personality changes. A doctor who is calm and cool becomes irritable, aggressive, or else a doctor who is very jovial becomes withdrawn and he starts becoming suspicious against the world. Now the question is, how to cope with this medical malpractice suits? Let's discuss each one of them. First step is to be prepared. Every doctor should understand this. You need to understand that it is an occupational hazard. Similar to road traffic accident, if you are driving a car or a vehicle, even though you are very careful, the person who is coming from the opposite side may bash you. That means it is an occupational hazard. Invariably, the medical malpractice suits can be filed against you. You are not immune to it. That you need to understand. Be prepared how to deal with medical malpractice suit. What to be done. How to protect yourself. The doctor should know about your legal rights. You need to know about the stages of grief, emotional turmoil which is associated with the medical malpractice suits should be understood before he faces it. You need to build the stress resilience and you need to cope with the failures in future. Invariably, the patient will die many a time because of the illness processes or else even by the error of judgment by the doctor, or even the doctor can be negligent also. In such a scenario, you need to be prepared to face this situation. You need to have good security personnel, training of this security, because nowadays the mob violence is very high. The people gather and destroy the hospital furnitures, and many a time other patients also will become victim of this violence. Training of your staff to deal with such violence to be done, proper documentation of the work by the doctor should be learnt, CCTV in the hospital public places should be placed, the doctors should take indemnity insurance to deal with such medical malpractice suits, need to have a good relationship with the local police station, have good liaising with them, provide good care to the police personnel and their family members. A crisis management team should be set up by the professional bodies and local IMA team and also by the colleagues so that in time of emergency and crisis, they can come to help. Second step, the medical records. Make sure your medical records are up to date. Cross-verify your notes. Cross verify your notes with the nurse's notes. Ask your colleagues to verify your notes. Review your medical records. Whenever there is a death of a patient, please update your records. Make a copy of the medical record and keep that copy with you, because many a time the police will take the originals and you do not have any medical record. In such a situation, better to have a copy of the medical record. Hand over the original records to the appropriate legal authorities. That's very essential. Without having a proper documentation, and if the police personnel who is investigating the case, please do cooperate with them. Please provide the original after receiving an application from them. Third step, please take a legal opinion. Consult a lawyer. If there is an impending arrest warrant, talk to your lawyer. Many a time, the local politicians, patients' relatives press charges on Saturday or maybe in the Friday evening. During that period, you need to ask for anticipatory bail through a advocate. Whenever there is a legal notice served to you, go through that notice thoroughly, read it many times, talk to your colleagues and friends, and also consult a lawyer. If there is a summons, please honor the summons. And if you are unable to attend the summons, please ask for another date from the court. Please do talk to a medico-legal expert how to answer in the court of law, how to respond to a complaint. Please do facilitate the investigation. Do not become defensive. Do not start blaming. Do not start shouting at the investigating officer or the patient's family members. Please remember, they are also at loss. They have lost a family member. Be kind to them. Fourth step, talk to your colleagues. Whenever you have lost a patient, invariably, you will feel sorry, you will feel guilt. But don't isolate yourself. Keep in touch with your colleagues, fellow professionals. Talk to your seniors. Talk to your mentor. Go to them. Discuss your case. Be active in professional society. Present this case in a local professional body. Take their help. Take their guidance. See how to defend your case. Make aware of your case with your professional body. Tell them what has happened. And even possible, discuss with them. Of course, please do not put it on social media, because when the case is in the court, it is sub judice. However, for academic purpose, you can discuss with your colleagues only. But remember, do not isolate yourself. Fifth step is engaging media. Be aware of the media and social media trolling. Invariably, there will be headlines, both in television, newspaper, local media, and social media. So, learn to deal with media trolling and media trial. Stay away from social media for a time being. Request your family members to be away from social media. In one of the physician's case, his family members, his children were threatened on social media. They were trolled. They were called the killer's children. So this kind of public rage, mob psychology does not prevent threatening the doctor's children also. So request them to be away from social media. And you being a doctor, do not give any opinion on social media or media without talking to your legal advisor. And also, without knowing the actual complaint, do not try to defend yourself on media trial. Many a time, this may go against you. Hence, please consult a lawyer. Sixth step is debriefing. The debriefing should occur within the hospital, along with your nurse, staff, and other workers within the hospital. Not only that, debriefing should occur at home also. You need to discuss with your wife, maybe your spouse, children, relatives, brothers and sisters, because they do not know what has happened. Invariably, the public and media may bombard them with various questions. Hence, you need to debrief them and request them not to respond or react on social media. Emotional support is very essential, not only for you, the whole family. Many a time, this media may target the family members, your staff, and many other people. So, debriefing is very essential so that you are together and deal this situation as a group. Seventh step is managing your own emotions. Whenever such credibility question arises, you will have panic attacks, you will have frustration, irritability. Hence, doing yoga, relaxation, going to temple, going to masjid, church will help you to calm down. Do regular exercise, take frequent breaks. Whenever your emotions are heightened, do not see patients, because in heightened emotions, your thinking process will be completely wrong. In many a time, you may require therapy from psychiatrist, and majority of the doctors may even think of going to spirituality. Eighth step, learn to endure this battle. Especially in India, this medical malpractice suits runs for decades, many a time 2 decades. And the case will not be in a single forum. It may be in consumer forum, it may be in state medical council, it may be in state human rights commission, national human rights commission, women commission, even in clinical establishment act board, even in the hospital. The battle will be many. You need to learn to deal with this battle. You need to build your resilience. You need to change your thinking process, because this battle is not over in a month or in a year. It will run for many years. Many a time, if the patient's family appeal, it may go through 2 to 3 decades. You need to deal this battle, and you need to learn how to deal with this battle. There was an important study published in 2004, Journal of Psychosomatic Research. Suicide in doctors, a psychological autopsy study was done. In this study, 38 working doctors who died by suicide, and they found that psychiatric illness was found in 25 doctors, my dear friends. Hence, do not hesitate to seek help. Unfortunately, doctors are the worst patients. Many a time, they feel that why should I go to psychiatrist? I have not done anything wrong. Yes, you have not done anything wrong. You require help to deal with your emotions. Unless you deal with your emotions, you will not be able to practice. Invariably, you will become defensive practice. You may quit the practice. Many a time, you may do self-medication. You may use drugs. You may use alcohol. Many a time, you may think of ending your life, because invariably anesthetic drugs are easily accessible to you. Hence, you need to be away and take professional medical help. Talking to a psychiatrist will help you. And you may require medications if you are severely depressed. But however, never take your life. It's just a passing phase in your life. It's a bad time. Learn to deal with this situation. If a worst case scenario occurs, change the profession. Don't kill yourself. Finally, observe yourself. That means observe your thoughts, observe your emotions, because malpractice suits will induce change in your thinking process, in your emotions, in your personality. Hence, observe this. Discuss with your psychiatrist how to deal with your emotions, thought process. Make sure that your malpractice suit does not affect your patient care. Your future patients should be safe in your hands. Because of this case, don't become aggressive. Don't start defensive practice. Please do seek a mentor. Practice under them for a few months until your emotions are under your control, my dear friends. These are the important 10 steps you need to follow whenever there is a medical malpractice suit is filed against you. To conclude, medical malpractice suits affects not only the physician, the patient's family, and the society at large. The reason being, these kind of medical malpractice suits will induce paranoia not only in the society but also in the physician. Defensive practice will increase. The doctors will not take a risk. They will not operate or see very severely sick patients. They will start referring them. They will refuse to treat them. Many a time they say, I'm not competent enough to do operation, or they will refer to higher centers. Not only that, all doctors should know and be prepared for malpractice suits. The reason being is, in the contemporary world, we do not trust anybody. And of course, doctor is also from the same society. And no doctor is immune to medical malpractice suits, my dear friends. Thank you very much for your valuable time. Stay safe.